Good morning, good afternoon, and good evening, everyone. Today we're going to dive into a critical aspect of women's sexual health: bacterial, sexually transmitted infections, and vaginitis. Understanding these conditions is essential for making informed decisions about women's health and well being. STIs and vaginal infections have a long history, dating back centuries. In ancient times, STIs were often misunderstood and associated with moral judgment rather than treated as medical conditions. Society looked at STIs as moral punishment for engaging in immoral activities. As described in the textbook, race knows no class or racial, ethnic, or social barriers. All individuals are vulnerable if exposed to these infectious organisms. Although STIs are a modern epidemic, they are not a modern infection. In many different cultures and religions, there are centuries of evidence of STIs. The graph on this slide shows syphilis cases since 1951. It shows just how much the number of syphilis cases have grown in the last 15 years. Let's look at some statistics to understand the prevalence and impact of bacterial STIs and vaginitis. More than 110 Americans are now living with sexually transmitted infection, and according to the World Health Organization, millions of new cases of STIs are reported each year globally. That said, measuring the severity of the STI epidemic is a difficult task. Some infections are extremely hard to retrieve accurate data on. As seen from the data here, the youth are most affected by STIs, and as seen in the second illustration, certain states and regions have worse STI problems than others. There are drastic racial disparities when discussing STIs. For example, chlamydia is more than 5 times more common and gonorrhea is 8 times more likely among black females than white females. Factors such as access to healthcare, socioeconomic status, and cultural norms can influence rates of infection and treatment outcomes. Addressing disparities in healthcare access and promoting culturally sensitive education and outreach programs are crucial steps in combating these disparities. Testing options are commonly directed towards white women and upper-class communities. Lingering discrimination has reduced trust among African American and Latino communities, making the difficult task of seeking treatment even harder. It's also important to address the societal stigma that often surrounds STIs. Despite the progress we've made in understanding and treating these conditions, there remains a pervasive stigma attached to them. This stigma can have profound effects on individuals' mental and emotional well-being, as well as their willingness to seek testing and treatment. Furthermore, the stigma surrounding STIs intersects with other forms of discrimination, including sexism, racism, and homophobia. Women, people of color, and LGBTQ+ individuals may face additional layers of stigma and barriers to accessing care. This can exacerbate existing health disparities and contribute to unequal health outcomes. The direct economic effects of STIs are not to be understated. Medical costs for all STIs in the United States are more than $16 billion a year. The direct medical costs associated with diagnosis, treatment, and management of these conditions are clearly substantial. Additionally, the indirect costs, such as lost productivity and quality of life, further contribute to the economic burden. Investing in comprehensive sexual health education, accessible healthcare services, and prevention can help alleviate some of these individual economic burdens. Not only are Americans spending billions of dollars a year on STI treatment, the government and private institutions are also pumping money into the cause. Over the last 50 years, spending on STIs and HIV specifically have grown significantly, leading to a 51% reduction in HIV-related deaths from 2004 to 2017. Let's briefly discuss how STIs are transmitted before we explore the different kinds of STIs. Bacterial STIs, such as chlamydia and gonorrhea, are typically transmitted through sexual contact with an infected partner. These bacteria can infect the genital tract, leading to symptoms such as discharge, pain during urination, and genital itching. In some cases, These infections can spread to other parts of the body if left untreated. Bacteria, which cause gonorrhea, chlamydia, syphilis, vaginitis, and many other infections, receive nourishment from the fluid or tissues where they reside. Typically, the infected areas become warm, red, and swollen, and may accumulate pus. The reason bacterial infections that affect the reproductive organs are so hard to combat for women is because the pelvis is the ideal location for bacterial growth. Chlamydia and gonorrhea are two common bacterial STIs that require prompt diagnosis and treatment. Chlamydia is the most common and most reported bacterial STI. Chlamydia is particularly challenging to detect because it often presents without symptoms. Women especially don't typically experience these symptoms. Symptoms that do appear include unusual vaginal discharge or bleeding, painful urination, painful intercourse, pelvic pain, tenderness, and fever. Gonorrhea typically presents without symptoms, but if there are symptoms, they're similar to chlamydia. Gonorrhea is also unusual in the sense that it is most prevalent in southern states in the U.S. Pelvic inflammatory disease, PID, is a serious complication of untreated bacterial STIs, particularly chlamydia and gonorrhea. PID can lead to chronic pelvic pain, infertility, and an increased risk of ectopic pregnancy. PID is also one of the major causes of infertility and hospitalizations in young women. Syphilis, another bacterial STI, is another one of the more common and widely known STIs. And although it's still common today, syphilis was very common around the 1940s. There are three major stages of syphilis. Primary syphilis usually occurs 3 to 12 weeks after sexual contact with an infected individual and is simply a painless open sore at the site of sexual contact. Secondary syphilis occurs 1 week to 6 months later and includes a variety of symptoms, including a rash on the hands, the sole of the feet, and the external genital regions. The rashes may also develop into open sores. Tertiary syphilis can occur a decade or more after the initial infection. These symptoms are quite severe. They include heart disease, nerve and brain damage, spinal cord damage, blindness, and even death. Vaginitis, vaginal infections. Vaginitis are vaginal infections. Many other infections can be transmitted through non-sexual means. In this case, with vaginitis, they are not referred to as STIs. Yeast infection and bacterial vaginosis are examples of these. I'd also like to use this segment to provide some tips for avoiding vaginal infections as described in our textbook. Number 1, wipe front to back to avoid bacteria from the rectum entering the vagina. Number 2, avoid sexual contact with someone who has an STI. Number 3, wear cotton underwear. Avoid wearing tight or wet garments for an extended period. Number 4, avoid irritating substances. For example, bubble baths, harsh soaps, feminine hygiene sprays, douches, and deodorant tampons. Yeast infections are a well-known infection. Chances are you've heard of yeast infections. A yeast infection occurs when the population of yeast organisms grow large enough to irritate the vagina or vulva. Yeast infections are very common, and symptoms include a thick, white, cottage cheese type vaginal discharge, redness, swelling, and itching. That said, most women experience at least one yeast infection in their life. Medication is available over the counter, and once again, yeast infections are not typically sexually transmitted. Trichomoniasis and bacterial vaginosis are two other common vaginal infections. Trichomoniasis is caused by a parasite and is typically transmitted through sexual activity, but it can survive outside a human host. The parasite can survive on wet surfaces like a wet swimsuit or a wet towel. Some women don't experience symptoms, but symptoms include frothy, thin, grayish or greenish discharge, intense vaginal itching, an objectionable odor, pain during urination and intercourse, and urinary frequency. Trichomoniasis is treated with antibiotics. Bacterial vaginosis is an overgrowth of several species of vaginal organisms. Bacterial vaginosis can be spread through sexual activity, but BV has a variety of non-sexual causes. Symptoms include a gray or white frothy discharge that may be thick or watery and that may have an objectionable odor. These are the possible symptoms, but about 50% of women with BV are asymptomatic. This exploration of bacterial sexually transmitted infections and vaginitis underscores the importance of prioritizing women's health and well-being. These conditions not only impact physical health, but also carry significant social, economic, and emotional implications for individuals and communities. Throughout history, women have faced stigma and discrimination when it comes to sexual health, often being unfairly blamed for STIs and vaginal infections. This stigma can have detrimental effects on women's self-esteem, relationships, and access to care. It's essential that we challenge these harmful stereotypes and create environments where women feel empowered to seek the care and support they need without fear of judgment. Promoting women's health requires a collective effort from policymakers, healthcare providers, community organizations, and individuals. By working together, we can create a future where all women have the knowledge, resources, and support they need to live healthy, fulfilling lives. Let's continue to raise awareness, challenge stigma, and advocate for women's sexual and reproductive rights. Thank you.